So I'll tell you, after this shocking tragedy in my life, after that shocking tragedy in my life, see that particular night, it is one of the horrific nights in my life, nightmarish experience. So I was totally shattered, totally devastated, broken. So next day, not next day, after I joined, the very next day after I joined, Dr. Frank Amal, he happened to visit our hospital, Trivandrum Hospital. So I had an interaction with him. He's a wonderful doctor, anesthetist. While talking, he told me, I just expressed my desire to train the nursing staff, especially those who are posted in ICU and operation theatre, about some of the very basic life support mechanisms, life support procedures, maneuvers, and all that. So some mechanism we need to definitely evolve. So he said that he will certainly help me out. I'm really grateful to him. He took pains to go to the local government hospital, and he told me, in fact, suggested, because he did his post graduation from a local government hospital. He told me certainly the medical college or the government hospital Trivandrum, they must be having some such course. He went there, and to our pleasant surprise, he came back to me with a wealth of information. He told me that there is a course going on, and in collaboration with another apex body, expert group, and it is happening since 2 years, and wonderful. Whatever setup they have is it's really excellent. It is like center for excellence up to international standards, but surprisingly and sadly, regrettably, that has been grossly underutilized. That's what I said. They have simulators, they have evaluation methods and all that. And he said that that is offered free of cost, and it's only just 4 days course, that to 3 days online course, and people can attend from wherever they are. Only one day they need to come for this hands-on training, and it's free of cost, and they give a certificate also. But the only thing is they want 30 people, 30 people in one batch, mainly the nurses. So I thought if we are able to gather people, nominate people from Railway, Southern Railway, from different divisions, 30 plus the 30 nurses, we will be able to have our own group, and that requires the approval by DME also, so that we can take care. And whenever our doctors went, Dr. Ajit Kumar and Dr. Anu Peter went there, so they had the, in fact, opportunity to interact with them. They saw the center. They came back to me there, beautiful feedback. Then now Dr. Shanima went, and the faculty there, he was kind enough to give his time. And although she went alone, she was given a beautiful presentation. She was also very much impressed. Then I thought, why not, when it's happening in Trivandrum, that to 3 days online course they can have attend from wherever they are, and one day hands-on course that we can make arrangements. So with that, I thought that will go a long way. We know that no, we are not equipped actually to deal with such acute emergencies, especially in a divisional setup. Even in Perambur, I have seen there is a lot of flaws. All of us agree that our preparedness to deal with such acute emergencies, especially when people come with arrest. So we still have a long way to go. Even developed countries, lot of precious lives are lost on the way to hospital. But somebody reaches hospital, goes for arrest, then we should be able to give them basic support. So we were not able to intubate my wife that day. So that's what the discharge summary clearly mentions, that she came with arrest. She was taken to another hospital, intubation failed. So it was an esophagus, the tube. So that's what happened. And finally, when they revived her, they told that she may be revived, but she will be left with what shall I say? A lot of hypoxic damage has happened, irreversible brain damage, and she may go into the state of a persistent, vegetative state. So that was really very painful. Then they decided that I must do something now. So this is the exercise I have taken up. This is an emotional appeal. I request all the divisional heads, including PCMD, to this is an appeal. Request that kindly nominate five nurses from each division, senior nurses who are in charge of the medical ward, the ICU, and operation theatre, so that they can they can upgrade their skills. Because doctors, somehow we attend conferences, we do here, we go to meetings and we interact. But whereas for paramedical people, there's a lot of scope. So this is a golden opportunity. 3 days course only, one day you need to come here, and it's sort of offer free of cost, and shortly they are going to close also. So I think it's a nice opportunity. Dr. Shanima, if you're ready, you can carry on.
I'm ready, sir. I'm able to share now.
Yeah, good.
Good morning, everyone. So I'm going to talk about this facility which is available near our Petar Division Railway Hospital, which is it is inside the GH General Hospital campus at Trivandrum. and it is set up by the Department of Health Services itself, but with the financial aid from Tata Trust as well as technical support from Warwickshire Hospital in NHS England. So it is Kerala's first Apex Trauma and Emergency Learning Center. It is a center of excellence in trauma care. They provide training for emergency trauma as well as emergency medical training. And this the main highlight of this training is it is a simulation based system. That is, it is a program for only 2 to 3 days, and in the 2 days they will give theoretical or lectures in the smart classrooms. They have an excellent facility of around 5 smart classrooms, and in this classrooms, usually for 1 or 2 days, the theoretical things are taught, and after that, they are given hands-on training in advanced mannequins, basic and advanced mannequins, regarding all the emergency basic life-saving procedures. And another thing is most important thing is there is a simulation-based teaching also. That is, they have a simulation room in which there is a patient and there is a heart rhythm monitoring, and there is a defibrillator also. So and they have iPad kind of system, and from this iPad, the instructor will sit inside the console room and he can talk through the audio, and it will come as if this mannequin is talking. And suppose so we have the students will be standing, the trainees will be standing near this mannequin, and whatever the instructor is speaking from the console room, like he will say, I have come with chest pain and breathing difficulty. So then what is the next question we are supposed to ask? So we will ask, how long was the chest pain lasting? Suddenly this mannequin is going for an arrest, cardiac arrest, and his eyes will close, and there will be a rolling of eyes, and suddenly his heart rhythm monitor will show the rhythm which the instructor is choosing. So we have to suddenly see this rhythm, and we have to go through the algorithm and act accordingly. We may have to start CPR immediately. It will be a team of 4 or 5 trainees. So they will have to start the CPR immediately. They will have to use the defibrillator and resuscitate them. So this is video recorded also. And after this simulation exercise, the trainees will be taken to a debriefing room. In the debriefing room, that team of trainees will be shown in the video. There will be video recording of the entire exercise. They will be shown the video recording of the exercise, and they will be it will be discussed with them in detail, and they will be told where they went wrong or what should have been done instead of what they did, like that. So I think that's the main highlight of this program. Then so it is a training technique based on simulation based system, and they use sophisticated and advanced mannequins. There is a debriefing software solutions and a learning management system in the smart classroom technology. So they are adopting this method of train the trainer model. So we are the ones who have to provide training to the public as well as the paramedical staff. So for that, we have to be adequately trained first. So this is a train the trainer model of train model system. So it is a very good and vast center with a lot of facilities and lot of space inside. So this is the entrance. It is the Apex Trauma and Emergency Learning Center, set up under Department of Health and Family Welfare Kerala, supported by Tata Trust and NHS Trust UK. So these are the different courses they offer. One is the course for nursing assistants. It is a basic life support course for nursing assistants. Then for nurses, there are 2 courses. Actually, they have to be taken combined. It will be for 2 to 3 days. One is the nursing essentials course. That is, they are taught the essentials only, like the from the procedures from the starting from any puncture to assisting in intubation and all. So in this, the nurses are not uh, authorized to intubate actually, but they are taught up to putting the laryngeal mask airway. But they are trained on how to assist a doctor when he or she is intubating, like what to do next, what to give to the doctor fastly, and what should be while the doctor is intubating, what the nurse should do, how to take turns during CPR, like that. So that is the nursing essentials course, and this is the second course for nurses. That is the emergency nursing course. In this, they are taught more of an ACLS algorithm also. That is a partial knowledge of the ACLS algorithm is also given. So they are advised to take both these courses together. Then these are the courses for doctors. There is a basic emergency medicine course for doctors. All these are simulation-based programs. That is not only the mannequin, but also there is a simulation dummy in the simulation room, as I have mentioned previously. Then there is also an advanced emergency medicine course for doctors, in which they go through each and every rhythm, all the bradyarrhythmias and the tachyarrhythmias, and to respond medically as well as procedure wise to all those rhythms. That is taught in this advanced emergency medicine course for doctors. So this is a smart classroom. They have got a video sharing board as well as a normal board. And initially, the candidates or the participants are given adequate. They have this basic life support ACLS as well as emergency medicine materials or booklets available with them. So that is provided to the participants or the trainees, and they are taught initially in the smart classroom. So these are the mannequins available. 1 second. These are the mannequins available. They are taught this in this advanced emergency medicine course. They are also for doctors. They are also taught about emergency thoracostomy also. That is emergency ICD insertion for pneumothorax as well as massive pleural effusion training. Also, they are taught for doctors. So these are the basic simulation mannequins available. Then different LMA and intubation and this laryngoscope and different sizes of ET tube, how to intubate, how to choose the correct size. That also is taught, and we can see the lung expansion in this exposed mannequin also. So this is the simulation room, as I said. So this shows the cardiac monitor, and this is the dummy or the mannequin, and all the actions of this dummy are controlled by the instructor from the console. So whatever program or whatever rhythm he can choose, this mannequin will react accordingly to it. He will talk also according to whatever the instructor is saying. So if we are using see, if suppose there is a VF and this mannequin is going to is getting arrested, and we are using doing CPR and giving defibrillation shocks using this defibrillator as well, then it will show whether the good response will be shown by this mannequin, so with this program such like that. If our resuscitation is not up to the mark, or we are not providing correct shocks, then it will show asystole as well. So we can really know whether our skills are enough, or we correctly trying to save the patient, etc. So this is the defibrillation station available. So this is the debriefing room. So after the simulation exercise, the candidates or the trainees are shown this video, whatever they have done, whatever the instructor was responding to the mannequin, etc. The video is played here, and the instructor will go step by step along with the trainees to show what could have been done, or what expedition should have been done in order to have a better response, that is discussed here. So these are the different. This is a trauma, emergency trauma training that they are doing, the cervical roll and all, and this is the defibrillation, and this the instructor is watching the student intubating. So and these are the different uh, training sessions going on there. So this is for the nursing nurses course. They are shown how to do ambu ventilation as well as other different venipuncture techniques are also taught. And they are given, there are different mannequins so that they can practice themselves. Each candidate will be given a mannequin and will be um, closely monitored how he or she is giving the CPR, how he or she is trying to do the ambu, whether they are doing it in the correct way, etc. Whether their responses are in the correct algorithm, like that. So that is in brief about what all training are undergoing in this center.
Kamachi, just I have to thank our Chandrakumar and you for arranging this program. That Shanima has already given us some keynote, what are the programs to be there. So we will advise our doctors to attend. My main problem is this is the duty hours in the morning hours. It will be very difficult for all the doctors. Anyhow, we will try to attend. And one more request, I am inviting all the nurses from all the divisions. I request all the CMSs to nominate at least 3 nurses for one program is going to be conducted on 9th, next Saturday. So PCMD has already given approval for continuing nursing education program. So I request all the CMSs to nominate some doctors, some nurses and ANOs. Thank you very much. Thank you.